Hi, my name is Dr. Jennifer Soung. I'm a dermatologist and clinical researcher at Southern California Dermatology and clinical faculty at Harvard UCLA. Well, I definitely think that it's food allergies. Patients are always looking for a cause for their eczema, and they're wondering, if I just eliminate this food, will that cure my eczema? So I definitely think that this is one of the most common consult questions that we get in dermatology. And food and atopic dermatitis is one of those topics that's been so confusing in medicine, filled with so much strong opinions, social media advice, and well-meaning family members, and sometimes just enough truth to make those myths sound convincing. For atopic dermatitis and counseling patients on comorbidities, it can be really tricky. I feel these days that for any chronic autoimmune condition of the skin, it really means about approaching the patient as a whole. I will start with addressing what is the most important part of that atopic dermatitis spectrum of comorbidities. So I like to ask my patients, how does this disease impact you? And they will tell me how it's impacting them. Is it, I can't sleep, I'm itchy? And they'll tell you right away what's most important, and then we'll kind of address it in that order because it can be a lot. Parents often ask me, is regular sleep important? Absolutely. So I think when you are thinking about a chronic autoimmune condition, addressing all of those different things, what patients are eating, I'm not saying that food is the cause, but having a healthy, balanced diet is important, as well as good regular sleep on top of their routine skincare. So that sensitive skincare regimen of bathing daily and moisturizing on a regular basis are all so important. And if you give that to your patient, all of that on that same day, on that first visit, it can feel really overwhelming. On top of discussing a medication to help their inflammation, whether it's a topical, oral, or a biologic. When addressing other comorbidities, I review the patient's medical history and medications to understand the severity and the impact of those comorbidities in the setting of atopic dermatitis. So it all depends on the chronicity of the comorbidity, the severity. Again, I go back to food allergies because that's what I talked about in the panel, because that's the most common question. And patients immediately ask the classic question, am I allergic to gluten? And start these elimination diets. And what we do know is that in adults, atopic dermatitis can have food allergies in about 11% of adults and about 30% of kids. And so remember, in terms of screening, you only want to do a food allergy panel when there are symptoms or a clear history of immediate type hypersensitivity reactions.